What if I told you that a simple blood test could be the key to catching cancer earlier than ever before? This isn't science fiction. It's a groundbreaking development that could completely change how we screen for one of the world's deadliest diseases. Stick around, because the results of a new study are something you need to hear about. Imagine a single blood test that can scan for more than 50 different types of cancer. That's exactly what the Galleri tests, developed by a company called Grail, aims to do. And a recent trial in North America has just delivered some incredibly exciting results. Here's how it works. When a tumor grows, tiny fragments of its DNA break off and start circulating in the bloodstream. The Galleri test is designed to detect these specific DNA fragments, essentially finding the fingerprint of cancer in your blood. In a massive study involving 25,000 adults from the US and Canada, nearly 1 in every 100 people received a positive result from the test. Now, here's the crucial part. For over 60% of those who tested positive, cancer was later confirmed through traditional diagnostic methods. That's a significant number. But what's even more impressive is that over half of these cancers were caught at an early stage. This is a game changer because finding cancer early dramatically increases the chances of successful treatment and even a cure. Lead researcher Dr. Nima Nabovizada said this data could fundamentally change our approach to cancer screening. Why? Because the test picked up cancers that we currently have no routine screening for. We have mammograms for breast cancer and colonoscopies for bowel cancer. But what about ovarian, liver, stomach, or pancreatic cancer? A staggering 3/4 of the cancers detected by the Galleri test were these types, the ones that often go unnoticed until they much more advanced and harder to treat. Think about that for a second. Combining this blood test with existing screening methods could increase the number of cancers we detect by 7 times. Not only that, but in nearly 9 out of 10 cases, the test was able to correctly identify where in the body the cancer was located, helping doctors to speed up diagnosis and begin treatment much faster. Of course, with any major medical breakthrough, it's important to be both optimistic and cautious. The test isn't perfect. It produced some false positives, meaning it indicated cancer when there was none. On the flip side, it correctly ruled out cancer in over 99% of people who tested negative, which provides enormous peace of mind. Scientists not involved in the study rightly point out that more research is needed. The ultimate goal is to prove that this test not only detects cancer earlier but also saves lives by reducing cancer-related deaths. We also need to be careful about overdiagnosis, finding cancers that might never have caused any harm. These are valid concerns that need to be addressed. And that's exactly what's happening right now. The NHS in England is running its own massive trial with 140,000 patients, and the results are expected next year. If that trial is successful, the plan is to roll out the test to a further 1 million people. Sir Harpal Kumar from Grail put it perfectly when he said, "The vast majority of people who die from cancer do so because we find their cancers too late." This test is all about shifting that paradigm from late-stage discovery to early detection. So, while we're not quite at the point where this test is available to everyone, we are on the cusp of a potential revolution in cancer care. It offers hope for a future where more cancers are found at a treatable, even curable stage. It's a huge step forward, and we'll be watching the results of the NHS trial very closely. What are your thoughts on this technology? Let me know down in the comments. Thanks so much for watching! If you found this information valuable, please give this video a thumbs up and consider subscribing for more updates on the latest in science and health. See you in the next one!